Thank you so much to all of our panelists for coming and to all our distinguished guests as well. So we'll be starting out with conversations around the topic and talking about the objectives. We have a few questions for our panelists, and I'd like to start with Marta. So we know that the IHP is a project in Nigeria, and you have the organization or the project has been here for a while. What we'd like to know is, in light of, governments have changed since Palladium has been here, but in the light of the recent changes in government, what opportunities do you foresee for implementation and continuity, or maybe sustainability, of the public health policies and programs we have in Nigeria?
Thank you so much. I hope you can hear me. My name is Marta Levitt. I'm the Chief of Party for the USAID Integrated Health Program here in Nigeria. So this is actually a program of USAID. And they have designed a very interesting 7-year project, which is fully integrated, looking at all aspects of health at the primary health care level and systems that are required for primary health care. So it's a very complicated project, but I think it was the right way to go. So we have now been working for over 5 years. I've been here in Nigeria 5 years. So we are in Nigeria. We are funded by USAID Nigeria. So we are indigenous. I'm becoming more indigenous every day. So I just wanted to say that we are working in Bauchi, Kebbi, Sokoto, Ebony, and FCT. And the reason I say that is we have full, can we fix the mic? We have full, teams in every state. So we work at the state level, we work at LGAs, we work at all the PhD under one roof. And we're mobile all the time, going and visiting primary health care centers to improve the quality of services and access to services. So we have a deep, deep understanding and its challenges. And so when I speak today, it comes from the richness of what I have learned since I've been here. Okay. To let that bother me too much. I could probably speak loud without that. Okay, so first of all, whenever a new government emerges, there's always excitement and opportunity. There's no doubt. With the new administration you have in Nigeria, the potential and opportunities are endless. So it's a very exciting time. And also we have to hit while the iron is hot. So we really have to move quickly to make sure health is at the foremost of the new administration's thinking. And I think we do this by looking at the importance of investing in health and how it benefits the whole nation and the people of the country. So therefore I have three very important priorities, in my opinion, that will take us to the next level when it comes to health outcomes and impact. And I'm so glad the professor is here today, because the number one is investing in what we call financial risk protection schemes, but it's basically health insurance, BHCPF, a national health insurance, state health insurance, and you have the private sector HMOs, which I think are thriving on their own. We don't need to invest in them, but they are there to help to have universal health coverage. So I think that the most important thing at this point for this administration is to really invest to make sure its vulnerable people and others as well, those in the formal sector, private and public sectors, are fully covered by an insurance scheme or financial risk protection scheme. Now, this is, very important because it will help to prevent catastrophic medical expenses. I am sure all of us, I know in my family, have had experiences where a medical situation arises and we literally have to dig deep in our pockets. We may have to sell assets and to take care of the people we love so that they can get the health care they need. So investing in health insurance, health coverage, I know a lot of people say, insurance, why do we need insurance? I'm not sick. But to be frank, you will never know when you get there. It could be tomorrow, it could be a year from now, it could be 5 years from now. You never know. But once you're covered, you know that you can go somewhere without hesitation. I've seen so many people just hesitate accessing care because they have no money. And so they don't go. And that's why we still see these persistently high maternal and infant and child mortality rates. So we need to cover people. The one thing that's really interesting about investing in health is that we will see immediate impact. It doesn't take 10 years to see health outcomes improve. It happens instantly. You can see it. People say, oh, it's not enough time. No, if you do the right things, if people get the right care, you will see the improvements and fast. So that's like a little different than education. Education is the best investment in the long run, but health is the best investment for the now. In addition, let's see, what else do I want to say about health insurance? I just want to say we need to make sure that the health insurance schemes that we have are easily accessible to people. That means physically accessible, they can enroll easily, they may pay their premiums, and also financially accessible. And that the operations of these schemes are efficient so that people can get the care when they need it, where they need it. Now, the second kind of investment, which is critical, is in family planning. And the reason I say that is in family planning, first of all, we always say, when I came to Nigeria over 5 years ago, people said, oh, people don't want to use family planning. They may be interested a little bit in child spacing, but it's against their religion. So I thought to myself, well, I've lived in a lot of Islamic countries, and women do want to control their fertility. Anyway, I said, okay, let's see. So we began to train primary health care workers at all these primary health care centers, 1,300 in the 5 states. And we taught them all kinds of clinical skills, maternal, newborn health skills, family planning, how to insert implants, how to insert IUDs, how to give injectables, do counseling, etc. We did child health training, we did training on malaria, so we hit all the skill sets for primary health care workers. And once they were able to, and they felt confident, it was very interesting. Even during the training, we had women lining up to come for their family planning services. And it's so much, we ran out of commodities very quickly, and we had to have a waiting list. Now, why invest in family planning? Okay, one, the growing demand is huge. You can see that even in the NDHS of 2018, there was one state, I can't remember which one, it was 50% unmet need. Unmet need means there's a demand, but they're unable to get what they want and they need. Now, once we invest in family planning, and insurance agencies in particular should love family planning, because family planning, you avert unintended pregnancies, then you don't have to pay for antenatal care, delivery, complications, newborn care, postnatal care, child health services, all of these things. And the family also is able to take care of their children the way they want. They can educate them, clothe them, feed them. So it's a huge cost savings. I read a lot of literature. You have anywhere from return on investment 7 times all the way to 40 times. I'm erring on the 40 times. So I think for an if I were an insurance person, I would totally make sure I made family planning commodities easily accessible and in my MSP. The last one, which is a little more complicated, it's going to take more time, is nutrition that requires a multi-sectoral response. We need to make sure that people know how to feed their children, when to start feeding them, how to provide a diverse diet from accessible and affordable food, and then also that the agricultural industry really needs to grow, and production and processing of food needs to happen. When I first went to Bauchi, there were tomatoes just rotting on the side of the road. It was so sad for me, because what they say is like half of the produce they make rots. There's a way to process food that nothing gets wasted. So I think we have a long way to go, and I think the government can really benefit from investing in these 3 areas. Thank you.
Thank you so much, Marta. Thank you. Yes, please go ahead and give her a round of applause. So I think it's